Welcome back. You're still on to Health Matters and we're discussing spina bifida. This is the time when you can call. If you have questions about spina bifida or surrounding spina bifida, the number to call is 0808 054 2233. That's 0808 054 2233. And you can always tweet at CTV_Mary A. Now, doctor, assuming you've got a little child who's been diagnosed with spina bifida and you want to help him, what do you do?
The spina bifida, as I've said, the most severe form is the one that is obvious. So what we do essentially is to repair the spina bifida, to close that defect. So
when the defect is closed, does the back straighten up? I mean, that bump, does it disappear as well?
That's the essence of the surgery.
Okay.
It's actually to make it look normal, like a normal person. So we can repair it and close it to make it normal. At the same time, it's also important to do that because to prevent further injury to the spinal cord.
Okay, so there can be deterioration if you don't do
anything. So there can be risk for infection into the central nervous system through that defect if it is not closed on time. So, and if that occurs, patients can develop meningitis, can become septic, and that can kill the patient.
Okay, but when you have repaired it,
yes,
does the patient improve? Do things get better? You know, we've spoken about some form of paralysis, paraplegia, loss of motion with the two legs, sometimes retention of fluid in the brain, and also what was the third one?
Loss of bowel
control.
And bladder
now,
control.
when this is repaired, does any of these things improve?
It doesn't improve them because the injury has occurred. Neurological destruction has occurred in utero, so one cannot bring those back. The essence of surgery is to prevent further damage.
Okay.
And to make the back look normal.
So the surgery is necessary, but it's not.
Curable.
It does not cure
the patient.
The problem.
Yes.
Okay. Assuming somebody has one of these more hidden forms of spina bifida, is there a way of knowing without actually doing an examination? Can you see it? Is there an appearance?
Yes, there are some telltale signs that one can see at the back of someone that has a hidden type, so which includes the tuft of hair.
Tufts of hair at the back?
Around the back.
Just a minute, doctor. Let's get a phone call from Enugu. Hello. Philip? Are you there, Philip? We've lost Philip, so let's continue. So hair grows out of the back?
Around the region where the defect is, there may be tuft of hair. There may be discoloration around that place, darkening of the skin, or it can become lighter. Then there can also be dimples around that.
Which means a depression.
A depression around the midline region there. Or there can be a swelling around that place that is not typical.
But the person is not paralyzed.
Is not paralyzed.
Has good bowel and bladder control.
And bladder control.
And no retention of fluid in the brain.
In the brain.
So, to all intents and purposes, to all appearances, this is a normal person.
It's a normal person, but the danger there is that as the child grows, if a child has those signs, they can develop what we call theta cord syndrome.
Okay.
So what I mean by that is that the cord is attached to the skin and the bone, so that by when the child grows...
We're talking about the spinal cord here.
Yes, sir, the spinal cord is now attached. And instead of ascending as the child grows up, instead of the cord to move up, it will not move up. It will just stay in one place. So that will not put...
Can it cut?
It's not cut, but it will reduce the function of the spinal cord.
Okay. So
patient can now develop weakness of the limb. Some of them will become incontinent. So if we see those telltale signs as neurosurgeon, so what we do is to offer them surgery to detach it where it is attached.
Can these same people regain full use of their limbs, maybe by physiotherapy? Or
the hidden type?
All types?
All types is not possible, especially in the severe form of spina bifida, because the nervous control is already destroyed, so it's difficult for the limb to move.
Let's take Sheung on the line now. Hello, Sheung. Hello, Sheung.
Yeah, good morning, ma.
Good morning, Sheung from Lagos.
Yeah,
What's your
good morning,
question?
ma. Good afternoon, ma.
Good afternoon. What's your question? We can hear you. Hello, Sheung. Sheung, are you there? I think we've lost Sheung. But you can try again, Sheung. We'd love to hear your question. You were saying about the tethered cord, that it's not every case that can be restored to full use, the limbs restored to full use.
In tethered cord, if it is detected early, the limb function may return.
Okay.
So, and that is why when we see those telltale signs, we offer them surgery, so as to detach the attachment of the spinal cord to the surrounding structure, so as to prevent this tethered cord from occurring. Because once it occurs and is not taken care of on time, the patient may actually lose.
The person may become paraplegic, just as in the serious cases.
Serious case, yes.
But it does not affect growth, does it? The person can grow to his full height, her full height.
It doesn't affect growth.
Okay. Is that the only treatment option, just surgery, nothing else?
That's the only treatment. Essentially, that's the only treatment. But the treatment of care, the care of patients with spinal bifida is actually multidisciplinary.
Okay, so a spinal bifida patient doesn't just stop with the neurosurgery
alone.
What else must be done for him?
The patient may need a urologist to take care of the bladder function, the incontinence. They may need to do something about it.
But the picture I'm seeing now is that of a person who is totally dependent on other people. Can there be any form of independence for this kind of individual?
There can be, but at the initial stage, the patient will need supportive care from the parents, then from the caregiver. So if they are properly taken care of, they can actually achieve independence by having to mobilize through an assistive device. So either on a wheelchair, some of them can use crutches to move around.
Okay.
And once we do what we call continence surgery for them, for the bladder, they can actually decide when to pass urine. Either to pass catheter, then they will pass their urine.
Okay, so they now know when they want to pass the urine, and they can do that without any embarrassment. That's a lot better.
So with full complement of work of neurosurgeon, pediatric surgeon, urologist, they can actually achieve their full potential. So it can be independent and do a lot of things.
Since this is something so close to the brain, does it sometimes involve any allergy or any aversion to any drug?
It's been known that they have what we call latex allergy. Probably because they are exposed to being touched with a glove for a long time, they develop allergy to that. So they have what we call latex allergy.
Gloves are not the only things that are made with latex. Are there any naturally occurring latex things that people should be wary of?
Any naturally occurring thing that has latex in it, once they are allergic to latex, it's not all of them that are allergic to it.
Okay.
But those ones that develop it, we advise their parents to stop anything that has to do with latex. Stop using those that has to do with latex with them. For instance, now the catheter that they use is made up of latex.
They could react to that too.
Yes.
Let's go on a quick break. When we come back, we'll continue. Stay with us. We'll be back in another minute.